Nursing Union Denosa has expressed concerns after the Northwest Health Department head, Reuben Molete, was found wanting in a 470 million rands contract for the construction of a Brits Hospital in 2008. Denosa Secretary in the Northwest, Reuben Molete, joins us now to expand a little bit on this. Reuben, good to have you, and thank you very much for your time. Your immediate reaction to the news of the appearance of the head of the department in court over graft allegations?
Yeah, no, thanks to yourself and the viewers at home. No, look, we have learned that the HOD of the Department of Health in Northwest has handed himself over to the authorities in connection with the tender irregularities that happened while he was working in public works around 2008. And as an organization, we're concerned of that posture because that is the highest office ever that we expect to be above board. And as such, we registered our concerns with regard to that.
Now, there are parties who say they've previously flagged this particular individual before being appointed into this position as head of the department. Do you think the vetting systems of the various departments are failing?
No, obviously, there would have been a miscalculation or rather an oversight errors upon appointment of the HOD. However, that is an HR process that we think they think they have done a good job, but obviously with the current development, it then says somehow the vetting system then not protect with itself around the department.
This, of course, as you put it, happened in the Department of Public Works, not in this particular department. Have there been any questionable tendering processes in the department now with Mr. Molete at the helm?
No, there's never been any that we know of, at least. However, there's provision in dealing with this issue, whether you are in public works or not. But the Public Service Act is clear on how to deal with these matters of the public representatives or the officials of the government department with regard to this matter. And we must indicate that we are also concerned that the Department of Public Works is also not coming out clear on this matter. Because from what I said, this investigation run as far as from the Department of Public Works. So we're hoping that they themselves would have pronounced at least around this time on this matter.
Are you satisfied with the actions of the MEC so far in how he's addressing these developments, especially placing Mr. Molete on leave of absence, however, being, of course, at this point, given his full salary as head of the department?
Partially, we are fine with it because remember, we cannot expect him to be. We cannot expect the department to be business as usual. You remember that as an HOD, you then have the day-to-day duties of presiding over the tender processes. So already there's a questionable aspect around it. So we are fine that at least for some reason that they put him aside, but we are not happy because we don't understand the conditions of placing him in leave of absence. Because if it's to be placed on leave of absence, that is what one other aspect that will engage with the NBC to say he must then verify to us, because if it's placed on leave of absence for how long and what then is going to happen. But we are hoping that by the time we meet the NBC will then clarify this matter on us, because we will also not be comfortable that it's placed on leave of absence imagine if that leave of absence is going to be for 3 years or for the remainder of his years as an official of the department. It would also be a fruitless expenditure of paying individuals while they seated at home. But our great concern is that the Public Service Act has got provision in dealing with this thing. And the department that is responsible to communicate clearly with Department of Health is Department of Public Works. They are given powers to be dealing with this matter decisively moving forward.
All right, I appreciate your time. Reuben Molete there, Secretary of Denosa in the Northwest.